Welcome to this edition of the First Aid Show. When you're treating someone with a memory problem or dementia, this can create different challenges to make sure you provide the best care for the patient and at the same time including their family. We asked the paramedic, how would they help?
It is very common that we encounter people that have got memory problems or that have dementia or Alzheimer's, conditions like that. We, as much as we can, involve family members or neighbours in their care if we can, because they know what their usual presentation is. If the confusion is heightened, more severe, we can use the family member to reassure them and keep them as calm as possible. But also, if that behaviour has changed, that's an indication that they might need help or they might have an underlying infection. So my tips, if you encountered somebody that seemed very confused or distressed, is one, be calm and approachable, introduce yourself, use their first name or their given name, their preferred name, address them directly. Keep them from harming themselves, so walking out into the road, and think about all of their basic needs. What can you do that brings them comfort? So sometimes it might be holding something that keeps their hands occupied. Sometimes in the elderly you'll see that they like to comfort a doll or a teddy bear, and that can be really comforting. Warmth, a blanket, hot water bottle, anything that addresses their basic needs, and you can keep them calm and reassured until medical teams can get there to assess them.